Hi, everyone. Thank you all for being here today. I'm inspired to be hosting the HER2 Empower Listening Series with all these amazing, beautiful women and strong women. I am Mema Carmo, president and founder of Tigerlily, and I'm a 16-year breast cancer survivor, thriver, warrior, and unicorn. Thanks for being here today, and thank you, Puma, for your support in making this happen. Today, we're talking about HER2 positive, and we're highlighting some amazing and dynamic patient perspectives.
I am a two-time breast cancer survivor. I was diagnosed in 2019, also in 2012 with ductal carcinoma with HER2 positive stage 2. And I have two beautiful daughters. My daughter just graduated from college. So it was really hard going through the experiences with two teenage daughters at the time. And then, of course, now that they're adults, they're my caregivers. So they helped me through the 2019 diagnosis. But since then, after diagnosis, this second time wasn't as hard as the first because I did have a little bit more, I didn't want to, but experience as going through the process, even though there were some changes. This time I did have lymph nodes removed. That was one of the biggest changes. But since then, I'm healthy, I'm happy, and I'm here to help and educate and share with people that are going through treatment and post-treatment.
I've been doing this a little over 20 years, and I actually got into oncology while I was in nursing school. My best friend's mom got diagnosed with breast cancer, and I'm from a very small town, and it's always taboo in our community where you don't talk about having cancer. And so I was really intrigued by that. And in my husband's family, there is a history of breast cancer as well. And so I got into it. I love it. It's my passion. I love educating and helping folks, from either my own patients, the one in the grocery line. And so it's my pleasure to be here again, just to share my clinical and professional experience on today's platform.
Well, I'm from Puerto Rico. My journey began in May 2019 when my surgeon told me that my nodules were removed. They removed 4 nodules and 3 of them were positive. So they found first the metastasis, and then they didn't found never a tumor or anything in the breast, but they know it was breast cancer because of the pathology, no? So it was shocking. It was the first you think it's like, oh my God, what is this?
Thank you for sharing your journey, your energy. It's so amazing. I know how much when you hear the words, yeah, breast cancer, it can be disempowering, but to hear that you were empowered to find joy, and you seem like you're exuberantly filled with joy, is just inspiring to me. So thank you for being who you are and for being here with us today. Let's just jump right into it. Tijuana, can you share a difference about, we're talking about, by the way, for those who are listening, HER2 breast cancer. Tijuana, I'm going to ask you to share the difference between HER2 plus and HER2 negative early stage breast cancer, and also what does HER stand for?
So traditionally, when a woman is diagnosed with breast cancer, there's a process that kind of comes along with it. So usually either someone feels a lump or a mass, or they go for their screening mammogram, they see something, they get a call back. And of course, that's really scary, right? And there's so much to decipher and understand when you hear those words. So not only are you hearing, oh, you have cancer, but then you hear all this stuff about ER, PR, or HER2. And so when we're looking at breast cancers, we're actually checking it to see what type of receptors are these breast cancers are expressing, okay? And HER2 is one of those things that we're looking for. HER2 positive just means that this patient, whether it's female or male, their breast cancer is having an overexpression of this HER2 new protein. It stands for human epidermal growth receptor 2. And the thing about HER2 positivity, so on normal breast tissues, we all express in normal amounts these HER2 receptors. And someone who has an overexpression, they have HER2 positive breast cancer, that just means that protein is now so rapidly dividing and multiplying that it's making too much of this protein. And that's what causes this breast cancer, okay? So they check the tumor for the HER2 status. So HER2 positive, that's what it stands for. HER2 negative means that when they looked at that breast cancer, they send it off to the lab, the pathologist reviews it, looks at it, and either it's going to be HER2 positive or negative. When you get the report, and many patients sometimes don't understand the reports, it will either come out and it'll say HER2 negative, meaning that it was 0 or 1 plus, or it's 3 plus, meaning is there overexpression. And now we do have this concept now where we're looking at patients who may have HER2 low expression. And so that's where you get your HER2 positive and negative from. And so HER2 negative just means that that breast cancer does not express that HER2 overexpression.
Is HER2 plus rare? If breast cancer recurs, if you have HER2, will it come back as HER2 or another subtype?
So good question. So for the first question, in regards to is it rare? So not that it's rare. I want to say that as we've advanced in the last 20 plus years, we now have been able to pick up on this and actually target it. And so it's not a rare breast cancer. I think now as we've been able to now have advocacy groups and like your organization as well, getting the word out. So it's not rare, but it is an aggressive subtype of breast cancer. I think oftentimes we hear about triple negative or people who have estrogen positive disease and everybody knows about tamoxifen. And so now you have this HER2 overexpression that can be seen. And then once you know that the patient has it, we can now target it with therapy. The second part of the question, I think you asked, is it going to come back? And if it comes back, will you have it? So there are two ways to look at it. So in the event like Kimberly, she had 2 diagnoses of breast cancer in 2012 and 2019, and her tumors express the same thing. There are some times where a patient may have a recurrence and they may not be HER2 positive the second time around. So it could be a totally different primary breast cancer, a new diagnosis, and they may not have the same receptor status. In someone who does have an early diagnosis of breast cancer, there's always this thought in the community if it's going to come back. We know that HER2 positive disease can be aggressive, and with other treatments now, hopefully we're able to give our patients these medicines to target that and block that expression and hopefully prevent a recurrence. Unfortunately, there are times when the disease will come back, and there is a higher likelihood that when it comes back, you worry about brain metastasis, but we have great medicines now in that setting to help that. So we know one that HER2 is aggressive, and part of your treatment is one, staying on treatment for the long haul. And then now we do have adjuvant therapy once they finish their surgery and their IV portion, where they can take additional medicine for a year to hopefully reduce that recurrence.
This is all really, really helpful. It was never explained to me this in depth when I got diagnosed. And it's so awesome to have someone explain the details of what the words mean and how they can impact, you throughout your breast cancer and your life journey. How does a doctor find out that you have breast cancer? What kind of testing is available to determine this, that a person does have breast cancer?
Yes. So as I alluded to earlier, so when the patient either feels the mass or they go for an abdominal mammogram, oftentimes you'll go for a biopsy, whether it's a stereotactic biopsy, finding an aspiration. Once those cells have been removed from the patient, you send it off to the lab. The pathologist will review it. A pathologist is a doctor who specializes in looking at cells, normal cells and abnormal cells. And once it's been discovered that you have breast cancer, then you now have to decide, okay, what type of breast cancer? Is it a ductal carcinoma in situ? Is it invasive? Is it lobular? And then they now test for, and they've always tested for receptor status. And that's when they're looking to see if the patient's expressing estrogen, progesterone, as well as HER2 new. Once that's been discovered, you come back into the office usually, whether it's your surgeon or your oncologist. Now there's a discussion about what you're going to do. When you're HER2 new positive, you have to do something. In regards to treatment, it's whether you're going to have perioperative treatment, meaning you're going to have neoadjuvant therapy that you're going to have before the surgery. And in those times, oftentimes you're getting chemotherapy up front, usually to help shrink the mass and kind of do what we call cytoreduction, meaning that mass is probably pretty big and you want to shrink it and get it down as much as possible. There are times where they also may check the lymph nodes, and depending on that, it then will dictate surgical options, but you'll usually get your treatment if you're a candidate for perioperative therapy. If not, say for instance, the patient has a very small tumor, it gets sent out to the lab, it comes back saying that it's HER2 new positive, they will get what we call adjuvant therapy. So the surgery was the main therapy up front, and then they would move on to now get their chemotherapy, which would be a combination of chemotherapy as well as monoclonal antibodies, which is what our targeted therapies are.
Thank you for that explanation. Very well, very, very thorough. Appreciate it. I wanted to go back to the advocates a little bit. Kimberly, In terms of your finding out that you were HER2, how did your doctor find out that you were HER2? Did they ask you questions about genetic testing and all of that to determine your diagnosis?
So when I was diagnosed the first time, no, not in 2012. I didn't know anything about HER2. I know that it was on my paperwork, but I didn't get any explanation as to what it was.
The healthcare team that you select is
Yes.
a critical part of your journey. And it can impact even, not just your survival, which is your life. It's so important that that person is going to be your partner in helping you fight for your life. What was different about the first occurrence and then the second time?
What was different from the first time that, like I said, I didn't know anything and I didn't know to advocate for myself like you did, Mima. That was really strong of you to do, to fire your doctor. When now I know to, well, the 2019, I knew to, advocate for myself, and with the help of, other breast cancer organizations, I was able to learn and, educate myself on, the different things. So I knew what to look for and the questions to ask, and just to make sure that the team that I chose was going to be able to not only assist me through the process, but also to work from my inside out, because it's a lot of mental. So, to do the mental to help me to, go through the process, and to make sure I break down all of the elements of the breast cancer itself, as well as to, work on the physical. It's really important to advocate for yourself.
You mentioned the mental aspect of it, and people don't discuss that a lot. And so, getting through cancer is a mental exercise in itself. But then having to deal with the fact of not understanding what you're dealing with, not understanding what may happen throughout the journey, that's also an issue, right? So the healthcare provider team is so important, but also even having mental health support, because this is a life event, right? Is impacting your life. Irmaly, you seem really positive, and you said you came out of it like, oh my God, I know my life's going to get better. That's really not always the norm. Can you explain where that energy and positive, feeling came from?
I really don't know. I'm a psychologist. All you said about mental health, yes, it's so, so true. I have my psychologist. I'm a psychologist and I have one, because I think that's a very powerful state of mind to work with all of this. Emotional intelligence, everything. It's very hard to know all you can suffer, or those symptoms that you don't know how to manage.
What do you think about that, Kimberly? Because you, of course, we talked a few times, and you just seem to be every time we talk, you're you're coming up. So tell me how, how you were empowered throughout your journey as well.
So I just stay positive, and I'm spiritual, so that helped me a lot. Just being spiritual, and just being positive, staying with positive people that are going to uplift me on those down days, because you're not going to be feeling good every day. And then when you're not feeling good, when your body is aching, you're in pain, you're not feeling well, you're not happy. So just, staying positive, get around people that are going to uplift you when you're down. My kids are everything. They are extremely amazing caregivers. I can't give them enough of praise. They've seen me through the beginning, the end of both times, and just, staying positive and uplifting, and just get yourself out there, talk to people. I feel like personally, me, myself, it is my job. It is my duty. I take this very serious, to educate people and to talk to people. I tell everyone that I meet, believe it or not, I talk to everyone that I meet, and I let them know about my story, because I want them to, know more about breast cancer than I did, because I didn't know anything. And then I also want people to, reach out to those different organizations, because there are people that don't have caregivers. There are people that are going through the entire fight alone, and it's not fair. And, it's good to have this organization that people can reach out to have that one special friend that they can, get it all out and talk to someone, because not everybody, wants to go see a psychiatrist or a psychologist, even though they get a bad rap sometimes. But I feel like you should be able to talk about it with people, because if not, then it can, if you keep that in, it'll eat you up from the inside out. And then you want to make sure that you're putting that education out there, for one, so that you can have other people to, because I found my own cancer. So, even those breast exams, I show people or tell people or talk to people about how to do a proper breast exam. Now that's very important, especially with our young people, because I wasn't old enough to have a mammogram, but if I would have done proper breast exams, or OBGYN visits, and done those proper breast exams, then I would have known prior to a stage 2, I believe. And then also the doctor, I went to the doctor, I did find my own cancer the first time and the second time, but I did go to the doctor and I pointed these things out, but because I didn't know, I was not educated, and I didn't know was a big problem. So that's why I always talk to people about, if you feel something on one side and you don't feel it on the other side, you definitely want to go get that checked out, go to the doctor. So these type of things are important, just little tidbits of like that. Thank you.
It was amazing. It's everything you said. I mean, self-advocacy, having a family that was supportive of you. I want to ask Tijuana, who's a professional, can you explain about, HER2 positive breast cancer? And, for those who are watching, who are new to this, who are just learning about their journey, is it aggressive?
It is. And so HER2 positive breast cancer is an aggressive subtype. Just because you have that overexpression of these HER2 new proteins that are continuously replicating and outgrowing normal cells, right? And that's what aggressive means. It means that there's a higher likelihood that the cancer will come back, and a higher incidence that if it comes back, that it will likely go to the brain. And so that's what aggressive means. But what I try to do when I'm talking to, whether it's a family member or a friend, stay on top of your doctor's appointments, take in questions, take a pad with you. In the pandemic, we didn't really allow many family members in. And so there are options to do FaceTime or get somebody on the phone, but have another set of ears, have questions written down, and the questions need to be answered. If the doctor or the advanced practice provider, whoever's on your care team that's not taking that time to truly address your questions and your concerns, then it may be time to do like you do, fire your doctor and find someone who's willing to listen. It's our job. This is what we do for a living. This is our profession. We have expertise in this, and you guys don't. And we're supposed to be there for you guys to help guide through the process. And it's important to understand that, you have this breast cancer that's aggressive. You need to still be doing your breast exams. Like Kimberly said, do your breast exams. I tell patients, get to know your girls. That is your body. No one knows your body better than you. And like Kimberly said, while she was not an expert in doing breast exams, she found it twice. And it's just knowing that, hey, that feels a bit different on this side versus that side, or that skin on that side didn't look as well, or something looks swollen. So knowing all those things and the aspects about your body, and just making sure you go in and talk to someone, stay on top of your appointments, don't miss them, take your medications. If you're having a side effect, talk to the doctors and find out, okay, well, tell them about the side effect. How is it impacting your quality of life, your daily activities, and see if there's a dose reduction or another option that you may be able to go on. You have to have that kind of dialogue to really truly help tailor your treatment. And I think one of the things that I think when we're talking and sharing our experiences, when someone has breast cancer or any cancer for that matter, everyone thinks that the same treatment should be done for each patient. And so you have these instances where people are sharing, oh, I have breast cancer. Oh yeah, I have it too. Oh, what did you get? Oh, I got this. Oh, I didn't get that. And so, they think it's all cookie cutter, but there are times when your disease you may have the same diagnosis, but someone's disease may not be as aggressive, and they may not have the same receptor status. And so things may change and alter based on those things.
How does knowing your status affect treatment planning? Because to your point, you just said, knowing when you know what kind of cancer you have, it's not just having that subtype, it's knowing your personal genetic makeup, and then how to tailor your treatment for that. Can you explain that to our viewers?
Yes, I'll do my best to try to break it up into different sections.
You always do.
So remember how we talked early on about, from diagnosis on. So you have the abnormal mammogram, you feel something, you get the mammogram, the ultrasound, the MRI, the biopsy, and now you hear you have cancer. You want to make sure that you get a copy of your pathology. And you will have people that want to have blind ignorance, or they're very overwhelmed, okay? But take the time to know your disease. Like Kimberly, she can tell you she had ductal carcinoma, HER2 positive. That is wonderful that she knows that. She knows that she was a stage 2. These are things that you want to write down, keep in a notebook, keep in a phone memo, or a note in your phone, but somewhere you can actually go back and reference it, because with Kimberly being as young as she is, she has daughters that need to know this, future grandchildren that need to know this, maybe other aunts, uncles, and siblings that need to know this. So not only just knowing your stage, but you want to know how big your tumor was. Was it 1 centimeter? Was it 2? Did I have 2 lymph nodes involved or not? And with Kimberly, I think I saw in the chat, she had 15 lymph nodes removed. That puts her at risk for developing lymphedema. So now you have to worry about that post-treatment. So going from knowing what type of cancer you have, you want to know your stage, right? You want to know your receptor status. You want to know if your tumor expresses estrogen and progesterone. And what do you do about that? I think Kimberly said tamoxifen. So yes, we used to do tamoxifen for 5 years. And then there was data where they actually studied patients and saw that patients actually have recurrences beyond 5 years, right? We used to say, get to 5 years, you are cancer free. But then we saw that there were patients that were having recurrences at 6 years, 7 years, 10 years, which then led us to doing tamoxifen or any anti-estrogen therapy for that matter for now 10 years. Okay, I would imagine at some point down the line, we may hear taking it longer, but you want to know what kind of treatment you need, how long you're going to take it, right? Patient is taking a anastrozole or any aromatase inhibitor, that will come with sometimes some bone loss. So now you have to worry about osteopenia, osteoporosis, and what do you do about that? Okay, so one, you want to know how big your tumor is, your stage, what type of surgery you had. Did you have a lumpectomy versus a mastectomy? How many lymph nodes did you have taken out? Did you even have any samples? Okay, once you have all that figured out, you worry about your treatment plan. Okay, you get the diagnosis, you kind of get some input about the tumor itself and what type. You want to know, am I going to be getting treatment before surgery or after my surgery? And what does that even entail? I think Irmaly says she did TCHP, which is a combination of chemotherapy as well as those monoclonal antibodies. Okay, that comes with side effects, diarrhea, hair loss, nausea, vomiting. With the HER2 targeted therapies, there can be some cardiac side effects, so we get echoes to monitor that. But you want to know, okay, how long am I going to get this regimen? Am I going to get it for 6 cycles, a year? How long? So once you get your chemotherapy, you then move on to what do you do after the surgery, after you complete your therapy. Now, not everyone will express estrogen or progesterone, right? So those patients, after they finish their chemotherapy, they get their monoclonal antibody, whether it's going to be your Herceptin alone, Herceptin and Perjeta, or even in some cases your Kadcyla, you're going to get that for a year, right? Then once that's done, what do you do? So if you're estrogen progesterone positive, you would be taking a tamoxifen like Kimberly, or you would be doing an aromatase inhibitor. If you're not, we now actually have another drug that's given in the early stage called neratinib. So you would take that for an additional year. So once you finish all the obby stuff, you then move on to a pill that you would take for a year. And then of course you're coming in and trying to understand, side effects, and trying to manage and navigate, and how do you tailor your treatment to make sure one that's tolerable for you, because you don't want to go on treatment and you're having terrible side effects and you can't finish it. So you want to have the open dialogue and trying to put all those pieces together. And that's a lot of information, but I think it's important for everyone to know the importance of knowing your stage, type of cancer, and then what treatments you'll be receiving.
Your explanations are so clear, concise, spot on. As a provider and a patient, we want to come to a provider who we can tell that cares about us, that loves us, that we're living this sacred life journey, that knows that they want to, in a sense, bring that feeling of caring to the conversation. And the way you expressed yourself and what you shared, how you shared it, was obvious that you bring that to your patients. And I just, as a patient, thank you for that, because we need to hear that every step of our journey. What are things that you learned throughout your journey that you wish you knew in the beginning of your journey that you would share with somebody who's learning they have HER2 positive breast cancer?
I learned how to eat. I learned how to sleep. I work a lot, so I learned how to sleep and when to sleep. Let the body drive you what the body needs. I think that is the best. Don't fight the body. Let the body rest when he wants to.
That's really powerful. I think that goes for before breast cancer too, right? And after. To me, love is about not just what is inside of you and self-care, but what's around you, who's around you, who's talking into your head, your heart, your soul. So thank you, Irmaly. Thank you for that. Kimberly, what What's something that you wish you knew then that you know now that you would share with somebody who's newly going through this a HER2 positive diagnosis?
Because it's so invasive. I had both cancer diagnoses were the same, and I didn't know that I was going to have. I do have lymphedema, so I have to wear the sleeve, and I go to the physical therapist every 3 weeks. So if I would have known how aggressive it was going to be, I would have done my due diligence with doing those breast exams a little bit more frequent, and I would have pushed for those even prior to. I mean, the lump was there. I found the lump, but the doctor was telling me that it wasn't breast cancer, and it definitely was. It kept getting bigger. If you get something and you see the lump and it's bigger than it was the month prior, or even months prior, or even a year prior, just go to the doctor and get it checked out. If that doctor says it's not that, then you still need to go to another doctor, because they don't want to give you a mammogram if you don't have any prior cancer diagnosis in your family. They don't want to give you a mammogram, anything over, under age 40. So I'm pushing for my kids. My daughter, she's scheduled to get her first mammogram. Is 10 years prior to the time that you were diagnosed. So I was diagnosed at 36, so she's 26 now. So she has to get her first mammogram, and then my second daughter, she'll get hers in a couple of years. But I would say, I wish I would have educated myself prior to 36 as to how to do the breast cancer, the breast exam, and to have a better diet, because that helps.
Well, they say that when
Kimberly,
you know
can I say-
better, you do better, and you're doing a lot better. So you're doing a great job.
Yeah, I got goosebumps just hearing Kimberly
Yeah.
just talk about, and the passion is kind of the same passion that I have. You know, I know in the medical community, everything we do is driven by science and data, right? But when I tell my patients come to me and they ask, oh, how do I know it's going to do this? Or is it coming back? Or am I going to live? Or I tell them, you weren't on that trial, and you're not just a number. I don't want to give you percentages. And yes, like in your instance, Kimberly, when they tell you, oh, you don't have a family history, you're too young or whatever. No, be persistent. If something is there, and I think sometimes that's why patients sometimes prefer to see me, because I work things up. You know your body. If something is not supposed to be there, God created our bodies so uniquely. He wove us so perfectly that when something is not supposed to be there, you're going to know it. And do not ignore it. And if someone wants to say that you're being a hypochondriac, or you're worrying too much, you have reason to worry, right?
You do.
We know
Yep.
that catching these breast cancers earlier, patients have longer survival. They do better, as opposed to watching and waiting. If it doesn't feel right, you go to someone who's going to have compassion and empathy and passion and care about you as a person, and not just the person that's coming in and out. You want to be able to have that relationship with your provider. I don't care if you cannot connect with someone and they're not willing to listen to you, then you may need to seek help elsewhere. But
Get another opinion.
diligent. Yeah, get another opinion. And if I have insurance and they're willing to pay for my mammogram, just order it. I don't care if I'm under 35. This is not supposed to be
Get
here.
it done.
Get it done. Who is it hurting?
Yeah. It's
No
about
one.
it's about your life,
Yeah.
right?
It's like a
You know,
simple,
so
non-invasive procedure, right? Get it done.
yeah. Thank you for joining us today. The resounding message I heard was that we have to be educated, we have to be our own best advocates, and we have to be empowered. And this is what we're all about, being empowered. So thanks for watching today, everyone. We really hope you learned, and that you leave this with some powerful tidbits to help you along your life and your health in your breast cancer journey. Until next time, bye for now, and thanks for watching. Brought to you in partnership with Puma Biotechnology.